As we all know, the world is in the midst of COVID-19 pandemic. Although this came as a surprise to most, the second and third wave of the pandemic hit hard all round the world. The most reliable way to fight back, at least for now, is through globalized and local vaccination programs. Vaccines save millions of lives each year by training and preparing the body's immune system to recognize and fight off the viruses and bacteria they target. Nevertheless, vaccines may also have side effects that make people worry and afraid. The scope of this campaign is to provide valid information about various vaccines and reliable sources for further reading. But let's take it from the beginning. COVID-19 is an illness caused by the new coronavirus, SARS-CoV-2. It was first reported in China at the end of 2019 and has now spread to many countries. From the beginning of the pandemic since today, the first quarter of 2021, there have been over 100 million cases of coronavirus, and more than 2 million COVID-19 related deaths recorded worldwide. In 80% of people, COVID-19 is not a severe disease, and no hospital treatment is necessary. About 15% of those infected require oxygen and hospital care, and an additional 5% need intensive care. While people over 60 years of age, and those with underlying medical conditions are at higher risk of developing serious illness, this can also happen to people of any age. As far as COVID-19 transmission is concerned, the disease is spread primarily through physical contact or droplets. A person with COVID-19 coughs or sneezes, spreading droplets into the air and into objects and surfaces in close proximity. Other people breathe in the droplets, or touch the objects or surfaces and then touch their eyes, nose, or mouth. Concerning preventive measures, physical distancing, washing hands with soap and water, or the use of hand sanitizer, good respiratory hygiene, and use of a mask, remain the main methods to prevent the spread of COVID-19, and seafarers should continue these practices even after getting vaccinated. In the second part of this video, we will try to provide some answers to the most frequent questions concerning COVID-19 vaccination. Vaccination is a safe, simple, and effective way to protect people from a disease before actual exposure to it. Vaccines stimulate the immune system to produce antibodies and other cells that fight disease, just as if a person was exposed to the disease itself. When a vaccine is given, the immune system responds firstly by recognizing the germ as foreign and identifying it. It then produces antibodies. These are proteins produced naturally by the immune system to fight the disease. Finally, the immune system, probed by the vaccine, remembers the disease and how to fight it. If the body sees the same germ again, it can recognize it and fight it, thus stopping the illness. Obviously, not all vaccines are the same. Let's see some of the different types. Nucleic acid, mRNA, or DNA vaccines like Pfizer-BioNTech, or Moderna, contain genetic material from the virus that instructs human cells to make the spike protein. This type of vaccine is safe, and does not affect the person's genes in any way. It is easy to develop, and the technology has been used in cancer patients for many years. Viral vector vaccines, like AstraZeneca, Sputnik V, Johnson & Johnson, and CanSino contain a safe version of a live virus, with genetic material from the COVID-19 virus inserted, that does not cause harm. This technology has been successfully used in the Ebola vaccine, and gene therapy. Inactivated or weakened virus vaccines such as the Sinopharm, CoronaVac, and Covaxin use a form of the virus that has been inactivated or weakened by heat or chemicals. This weakened virus does not cause disease, but is recognized by the body as foreign and stimulates an immune response. This method produces very safe vaccines, but more difficult to produce in a large scale. Many COVID-19 vaccines authorized for use in different countries are reported to be more than 50%, and often over 90% efficient, in preventing disease in those vaccinated. But are those vaccines safe? Can we be sure? All vaccines must undergo many phases of trials, first in a laboratory, and then in human volunteers, before approval for use in the wider population. Appropriate national, regional, or international authorities review and analyze the trial results. The authorities review the vaccine components, their quality, safety, and effectiveness. When national and regional authorities are satisfied that the vaccine is both effective at preventing disease in humans and safe to administer to people, it is authorized for use. So we could say that vaccines are at least as safe as any other drug that legally circulates in the market. The vaccine is our best weapon towards controlling, and finally defeating the disease. Therefore, everyone is encouraged to have it. Nevertheless, there could be side effects, especially for some categories of people. Let's see. People with allergies to any component of the vaccine. Although there have been few severe allergic and anaphylactic reactions to the vaccine, those with allergies to any vaccine component should not be vaccinated until reviewed by an appropriate doctor. Others with a history of allergy, anaphylaxis, or severe asthma should undergo a risk assessment, and if vaccinated, be monitored closely for the recommended period of time. People who are currently unwell. These people should mention their condition to their healthcare provider, to ensure that it is appropriate to be vaccinated at the time. Pregnant women. Although pregnant women are at higher risk of severe disease, and COVID-19 is associated with an increased risk of preterm birth, insufficient data is currently available to routinely recommend vaccination. If a pregnant or breastfeeding woman is at unavoidable risk of high exposure, or has a significant underlying medical condition, vaccination should be considered on an individual basis. Breastfeeding women. It is not yet clear whether COVID-19 vaccines can be excreted through breastfeeding, and if they are, what effect they may have on the milk or infant. mRNA vaccines are not thought to have any effect on the infant. People who are breastfeeding should discuss the risks and benefits of vaccination with their healthcare provider. Finally, young people. Currently, vaccines are being tested to see if they are appropriate for young people, and advice should be taken as to whether the specific vaccine being proposed has been authorized for people under 18 years of age. As far as side effects are concerned, up to 50% of individuals taking the vaccine may suffer from headache, fever, or fatigue. In general, side effects are reported to be mild and short-lived, lasting up to 48 hours, and can occur after the first or second dose. Local reactions such as pain, redness, and swelling are not uncommon, particularly in those under 55 years. These side effects respond well to paracetamol, and usually settle within 2 days. Serious side effects are reported to be extremely rare. Although it is not exactly the same with all the different types of vaccines, protection starts to develop approximately 12 days after the injection is given. Currently, COVID-19 vaccines can only be accessed through national, government-run vaccination programs. The industry is reviewing ways for seafarers to obtain authorized vaccines in the near term. Ongoing studies will establish in the future how long a person is immune to the COVID-19 virus after vaccination, and how often a vaccine is required, for example, annually like the flu vaccine or less frequently. Yes. For now, people that have taken the vaccine need to observe all quarantine rules and travel restrictions. This may change over time. It is currently unknown whether a vaccinated person can still carry the virus in their nose and throat without any symptoms, and whether they can pass it on to others. Until this is clear, it is essential that everybody, vaccinated or not, follows the guidelines for physical distancing, washing hands with soap and water or the use of hand sanitizer, good respiratory hygiene, and the use of masks where appropriate. Early laboratory trials indicate that vaccines currently authorized are effective against the new known variants. Nevertheless, further investigation on the matter is required. Thank you for watching. The basic source for this campaign is the guide, COVID-19 Vaccination for Seafarers and Shipping Companies, from International Chamber of Shipping. Until the disease is finally bitten, and you get your own vaccination, please uphold social distancing and hygiene rules, and remain safe.